to one of the most dreaded exams in medicine. The PillCam Colon, bite-sized camera to help screen patients who have trouble with colonoscopies. The Borland-Groover Clinic is the only one in Florida using this new technology. So how does it work? Dr. Chau and Filberto Sotolongo, who is a patient, joined us now to talk more about this technology. Gentlemen, welcome to both of you. Good to have you here. So the bottom line is that you'd still prefer to do a colonoscopy, but for someone where a colonoscopy is complete, this is an alternative.
That's correct, Bruce. So colonoscopy, as you might have known, is the second leading cause of cancer death. Colonoscopy is still the most effective way to screen for colon because it can also, when you do a colonoscopy, you see a polyp, you cut it out, and polyps are precursor to cancer. So when you cut it out, you prevent cancer. But in a small amount of patients, a small number of patients who cannot get a complete colonoscopy due to the colon being too long, or it's very tortuous and endoscopists cannot go through the entire colon, then colon PillCam offer a very good alternative for colon cancer screening.
But we've got to understand that it's just good for the screening because essentially all you're doing is taking a picture, and should there be a polyp, do something more invasive anyway.
That is correct. That's correct. And about 40% of patients who's over the age of 50 are more likely to have polyps at that time. So we're still trying to capture the other 60%.
Gotcha. So tell me a bit about your story and how this made a difference.
It makes a big difference because I feel relieved. After a failed colonoscopy, you don't know what's inside you. So going through this procedure, which was very little invasive, it makes me feel assured that I'm okay. The procedure was very simple. Swallowing the pill is more difficult than swallowing a large pill that you normally do on vitamins or whatever. And the procedure went well. I'm very happy, very relieved that I'm okay after going through this test.
But you still had to use the prep, particularly I call it the colonoscopy milkshake that helps illuminate your colon, which some people will argue that maybe is the worst part.
Actually, for most people, it is the worst prep. For this, you take half the prep the night before, and the day of the procedure, you show up with the other half, you bring it in, and you ingest a pill, which is actually not too big.
Here, let me show you.
Yeah. So this is the size of the pill. And it's slightly larger than a big vitamin pill. And when you ingest that capsule, you also start drinking the second half of the prep. And as the pill travels through the GI tract, it will take thousands and thousands of images, create a video of your internal GI tract. And the patient will wear a unit on the outside, a belt on the outside. Then the image from the capsule will be wirelessly transferred to the monitor unit.
Now, I know you're conducting a trial right now to see if maybe there's a wider practical application for this.
Right. So currently the colon PillCam is FDA approved only in cases of failed colonoscopy. And nationally, there's a study going on to see if this is a viable option as primary screening colonoscopy. And Borland-Groover will be one of the center to participate in this.
And I guess your suggestion to others would be, look, this brought you peace of mind, so don't be afraid of it.
Absolutely. Yes, absolutely.
Right, gentlemen, thank you very much for being here. Appreciate it.
Thank you, Bruce.
Thank you.
Take care.
Congratulations, by the way, on getting a clean bill of health. For more information about the PillCam, you can visit Borlandgroover.com. There's a link on News4Jax.com. Just look under the morning show page. And no, Stacy, you can't put your pictures on Shutterfly afterwards.